Okay, good morning. So I'm recording this lecture for the benefit of those who cannot attend our live lectures and para if there are power interruptions or problems with your internet connections, we can still discuss the topics that we need for this course. Okay? So, sige. Since we are on the topic of patient safety, infection control and prevention is very essential, no? To create a safe healthcare environment for your patients, the families of your patients, and syempre of kayo, your as a healthcare personnel. We have to be safe. Now, based on current statistics, there is one in 25 patients in the hospital that have acquired at least one healthcare associated infection. So this puts patient at great risk. Siyempre dahil bakit nga ba sila pupunta sa hospital, di ba? Because they have a disease or condition that needs to be treated. So this happens that they have a lower resistance to pathogen due to their health condition. Or pwede rin because of a medical procedure. Because all medical procedures are involves invasive procedures. So this incurs increasing hospitalization cost kasi syempre hahaba yung hospitalization nila pag nagkaroon sila ng infection or dagdag na infection or worse, baka ma-deteriorate yung health condition niya. Okay? So, let's go to, okay. So, mag-set muna tayo ng goals. For this topic, I am setting the goals to the explain the relationship between the infection chain and transmission of infection. What else? Give an example of preventing infection for each element of the infection chain. Isa yun sa mga pag-aaralan natin, the infection chain. Then, give signs and symptoms of localized infections to those of persistent infection. Later on, i-discuss natin yan. Okay, another is to identify normal defenses of the body against infection. Okay, discuss the events in the inflammatory process, inflammatory response, and explain conditions that promote the transmission of healthcare associated infection. Okay, we also will be able to identify patients most at risk for infection and then explain the difference between medical and surgical asepsis. Okay. We also have to explain the rationale for the standard precautions and perform proper procedures for hand hygiene, procedures for isolation category. That's your isolation-based precautions. And then explain how infection control measure differs in home versus the hospital. Okay. Properly apply disposable mask and sterile gloves, and that includes also your gown and your goggles. Understand the definition of occupational exposure and explain the post-exposure process. Okay? So it is important to know yung difference ng infection and colonization before we start. Okay. So, infection is the invasion of a susceptible host by pathogen or harmful microorganism that results in a disease. Okay, so for example, meron tayong mahina na immune system na tao. Okay, na-expose siya to pathogens or yung harmful microorganisms natin. And then it developed into a disease condition. So that is your infection. So how about colonization? Colonization is the presence and growth of microorganisms naman within a host but does not exhibit tissue invasion or damage. So, nandoon present yung microorganism pero it doesn't change the physical form of the body's tissue or hindi siya nagpo-cause ng damage doon sa tissue. Okay. So, anong example ng ng mga natin ng mga microorganisms that colonize and that invade? Okay, so here you have an example of Lactobacillus acidophilus and your Bilongum, both of which resides in the GI tract. So these bacteria are example of colonies present in your body, pero they don't have a searching numbers because our body, anong present sa stomach natin, GI tract natin, especially in the stomach. Di ba meron tayong acid in the stomach. This keeps their numbers from surging and they which they cannot invade or destroy the tissues under normal circumstances. Okay. So on the other hand naman, we have these pathogens or disease causing or harmful microorganisms who exhibit rapid growth in numbers. Dito naman, pag sinabing yung pathogens that cause infections, they alter the physiological characteristics of certain body tissues. Like for example, the tuberculosis in our PTB patients. They invade the lungs and they destroy the alveoli during their proliferation. Kaya pagtingin nyo sa X-ray, meron tayong nakikita mga white spots doon sa kung saan yung alveoli. They are taking over yung tissue ng lungs. Okay. We also have Clostridium tetani. Saan to? This is your tetanus causative agent. Okay, this enters the nervous system via the lower motor neuron sa mga kamay natin, sa paa, and then what else? And then it travels up to the spinal cord and to the brainstem. So ito si Clostridium tetani releases toxins which interferes tissue and eventually organ function. So if the disease has a pathogen that can be transferred from one person to another, ang tawag natin dyan is communicable disease. So these are your examples, si PTD and si tetani. Okay. So for those communicable diseases, it can be classified into two. Pwede siyang maging symptomatic or pwede siyang maging asymptomatic. So symptomatic, it means that there are visible or physiologic signs and symptoms. Pag asymptomatic naman, you still carry or the pathogens are present in your system, but you do not exhibit physiological signs and symptoms. Okay. So next, let's go to the chain of infection. In order to understand how infection works, you have to first learn the chain of infection. So the presence of pathogens does not entirely mean that an infection will occur. Okay, later on we will know why. Okay, an infection only occurs in the presence of the following elements. Ito na. You have your chain of infections. What are these? Your infectious agents, your reservoir, port of exit, mode of transmission, port of entry, and susceptible host. Okay. So, what is your infectious agents? So, these are the following microorganisms organisms that can be considered as an infectious agent. There are also microorganisms, though, that live in the body that in relative small numbers are not harmful. Ito na yung sinasabi ko kanina, yung colonization. Pero if uh, during these are considered not harmful under normal circumstances. Pero let's say, for example, there's a shift in the what do you call this? In the balance. For example, in the GI tract, in the stomach, there's a decrease in the acid production or the acidity of the stomach. So this will allow for those microorganisms to proliferate. Okay? So these increase in numbers will now be considered as invasion na of the uh, tissue in the GI tract. So nagkakaroon ng surge in the numbers of microorganisms. So what happened? Yung mga normal flora natin sa tiyan, if they are allowed to proliferate, it will cause harm now to their environment, which is yung stomach or yung GI tract. Kaya nagkakaroon ng ulcers, for example, di ba? Okay, what else? What are other infectious agents? So yun, we mentioned earlier about uh, your your microorganisms that cause tuberculosis. What else? Your E. coli. What else? Your um your pneumonia. What else? We have uh, your C. tetani. So these are examples of your infectious agents. Okay. So take for instance, ito yung sinasabi ko kanina na in our stomach we have around 10 to the power of 5 or 6 na number of H. pylori which are present in the stomach. So at least with these numbers, H. pylori cannot cause harm. So yung numbers nila are being kept at bay because of the normal acids that occur in our stomach. Okay, so yun na nga. It will be only harmful to our body if this balance is disturbed. Okay. So there is also this ability of the microorganisms to produce a disease. This is called the virulence. This is correlated with the ability of the pathogen to reproduce or multiply within the host. Okay. So in order for pathogens to cause a disease, it needs to be it depends on the following conditions. No? Number of microorganisms present, and then your ability to produce the disease, that is your virulence, and then the ability to enter and survive in a host. So this is your survivability. Oh, this is how the microorganisms adapt to a host internal environment. While susceptibility naman, this refers to the degree a host can defend of invading pathogen. Okay, so if mababa yung immune system mo, or if your system is weak, so this increases your susceptibility to infection. Okay. Okay, ano naman yung reservoir? This could be humans, this could be animals, This could be water, food, anything organic, or your fomites. So basically, it is a place where microorganisms survive and multiply. So just to ano lang elaborate on the fomites. These are your inanimate objects, no? Okay. So these are your reservoir. Okay. So ano naman, yung portal of exit naman natin. What is your portal of exit? This is the path by which a pathogen leaves a reservoir. Okay? So, usually yung pathogens will exit a human reservoir through body fluids or mucous membranes. So, very common is your respiratory tract, your through urine, through your gastrointestinal tract by vomiting, diba? If mahawakan niyo yung fluids and then it will be in close contact with other people, it can be uh, transferred through that process. It is also, pwede rin siya through your reproductive and your blood. Okay, this is the portal of exit. So, let's take to understand naman the different modes of transmission of a pathogen. So, every disease has a specific mode of transmission. We have your contact transmission. Number one, we have your contact transmission, no? Where it can be classified in two. Pwede siyang maging direct or indirect transmission. So, if the infectious agent is being passed on by means of physical contact to reservoir or contaminated droplets of the host, ano yun? Through sneezing, through coughing, and then directly tatama yung in contact with uh, the infected host. That is your direct transmission. Okay? So, while through indirect naman, this is through your objects naman. That if an infected person touches an object and then you also as a susceptible host touches the object, then that is your indirect transmission. Okay. Usually, respiratory diseases are transferred to either airborne, meaning the pathogens are being carried by dust. So, ito yung mga droplet nuclei na tinatawag nila. This is very small and can be suspended in dust. It can be float and it will float the air for a period of time. So nandiyan lang yan siya sa paligid. So on the other hand naman, yung droplet transmission natin, this is the infectious agent carried in the mouth, nose, throat, and other part of the respiratory tract. Okay. So, yung difference ng droplet and airborne is that the droplet only travels short distances. It is usually around 3 feet, no? Ito na yung through your cough or your sneeze, no? So, infection may occur at this time if in direct contact with the respiratory droplet. Pag ikaw naubuhan, nabutan ka ng mga drop of respiratory mucus or fluid, so you this type of transmission is your droplet transmission. Okay. Pwede rin naman siya through other person's respiratory tract or mucous membrane. Yun na nga. For example, naubuhan ka or nabahingan ka, hindi siya nag-cover ng mouth or hindi siya nag-cover ng nose. So that could also be your droplet transmission. So always remember droplet transmission. It's always within 3 feet from the infected host, while airborne is suspended in the air. This is your smaller particles that's being suspended in the air. So, okay. So ano naman yung mga vehicles, no? We also have vehicles and vectors, no? Your transmission through vectors. So these are your water solutions, pwede siya blood, pwede siya yung mga drug solutions na nagamit which came in close contact with the patient. Okay. So yung vectors naman natin is very common sa um, ano natin sa mga parasitical na infection. So these are your mosquitoes that carries parasites, pwede yung flies, no? This is your internal and external mechanical transfers. Mechanical meaning moving from one place to other. Kasi if you can observe the behavior of mosquitoes and flies, they go from one place to another. No? Okay. So portal of entry. Pathogens usually exit the human reservoir to body fluids or mucosal membrane. No? So, ganun din, no? Pag this portal of entry, no? By which, a path by which a pathogen enters the host. Pwede rin siya through your skin. If, for example, may sugat yung skin, there's a break in the integrity of your skin. So, this can be transferred, no? Uh, through your skin contact. Can also be transferred to your, they can also enter through your respiratory tract, pwedeng urinary. There are some parasites that enter your urinary tract and other like E. coli. If it is the if it was introduced doon sa urinary tract, and ascended into the upper urinary tract, that will cause your infection. So that is one of the example of portal of entry. No? Okay. Pwede rin through your blood or pwede rin yung through your reproductive tract. Okay. So, susceptible host. Ano naman ang susceptible host? This is the likability of a living organism to be influenced or harmed by a pathogen. Now, we are talking about the immunity of a person, no? Or a living thing for that matter. For those groups that are immunocompromised, patients in the hospital are example with a disease condition. For example, meron tayong mga patients with HIV/AIDS. So mababa there is a dysfunction sa immune system nila. So any pathogens that will try to enter the HIV/AIDS patient will be at great risk for infection. So, what else? Yung mga nagtitake na antibiotics, di ba? This can also be an example of those susceptible hosts, those in chemotherapy, where your immunity is being targeted also by the chemotherapy drug. And we have your children, kasi hindi pa develop yung immune system nila. Likewise naman, dun sa mga senior citizens natin na medyo hindi na gumagana yung immune system. So, these are your susceptible hosts. Okay. So by understanding itong chain of infection, now you have the knowledge to prevent infection. So each chain can be broken, each link in the chain can be broken only if you have the proper knowledge how to break this chain. Okay? So what are the factors affecting infection control and prevention? So ito kanina sinabi ko, example yung mga children and old age. They have susceptibility kasi it differs through a person's lifespan. So, pwedeng an infant has yet to develop body defenses against infection, which can greatly contribute to his or her susceptibility. Yung toddlers naman natin are prone to infection. For example, kasi their nature of play is inside and outside the household. Meron tayong mga yung uh, toddlers are very oral. Diba? They are trying to explore the world through their mouth. So, yun. This puts them at risk din for infection. How about school age children? So dito, since they are inside the school, they're grouped with other children. So meron tayong tinatawag na clustering. So yung children, pag meron isang bata na may infectious disease, it can be passed on kasi syempre the school age children are inside a closed room. So this is also putting them at risk, no? Then sometimes, no, I mean, as we grow up, may mga lifestyle changes din na we practice, like smoking, drinking. This can also lead to low immunity. So for those adolescent and adults, this can also pose as a factor that can affect our immunity or the infection control and prevention. And siyempre, yung kanina sinabi ko about old people, they have diminished their immune responses na, which put them at a great risk too. Okay, what else? Aside from age, we have nutritional status. The food we eat is the fuel for our bodily functions. If our immune system or immune response is the process that needs sufficient nutrients in order to function well. If hindi mo naman bibigyan ng tamang nutrition yung katawan mo, paano gagawa ng yung defense mechanism yung katawan mo without growing your WBCs or your cells that are responsible for your immune system, no? So it is very important that you eat right. So what else? Stress. What happens during stressful event is that the body due to an there is an increased metabolic rate. So the body is forced to increase the glucose level, which triggers no a response to release cortisol. So cortisol is a hormone no to reduce inflammatory response. So pag mababa yung inflammatory response natin, hindi nakaka-function yung mga pathogen preventing cells natin or yung WBC cells natin, no? So stress can also contribute to your infection prevention. So what else? Disease process, no? Some diseases put a person more at risk for infection. Like yung sinabi ko kanina about HIV/AIDS. And yung kanina sinabi ko na they have they have a dysfunction in their immune system. So what else? Yung mga cancer like leukemia, it also has a dysfunction in the immunity, no? So the disease process puts a person more vulnerable for that places the person more vulnerable to infection. Okay, so ito lang a quick overview lang of the inflammatory response. Yan, if you can see here, ito yung sa number 1, the bacteria and other pathogens enter the wound. Then we can see here the platelets from blood release. Ito, blood clotting proteins. Kasi it will try to close up the wound. And then we have your mast cells. Yung your factors. That can give vasodilation and vascular constriction. This is important, no? Kasi there will be leaking blood here. So this is why if you can see if there is a wound, it can be red and swollen, no? This is because of your mga factors. We have like factor 7, factor 8. This helps in the inflammatory response. So we also have your neutrophils, no? These also secrete factors that kill and degrade pathogens. So ito, kita niyo yung mga neutrophils that engulf the bacteria that is coming inside of the body. This is called phagocytosis. No? So what else? You also have your macrophages. No? These attract your immune system cells to the site and activate cells involved in tissue repair. So this is your inflammatory response. It continues until the foreign material is eliminated and wound is repaired. Okay, now let's go to your medical and surgical asepsis. So basically, we define asepsis as the absence of pathogens, no? Or as healthcare professionals, we are responsible for practicing aseptic techniques. These are practices that help reduce the risk of infection. So ito na yung two types of aseptic techniques, your medical and surgical, no? But first, let's what is medical aseptic technique? This usually breaks the chain infection. This is used in all types of patients, even if infection is not present. Okay, so this is your standard precaution. No, this is your hand washing, barrier techniques, and environmental cleaning. No, okay. How about surgical septic technique? Ito naman, this is for the prevention of contamination of an open wound, or if you need to isolate an area or an operated area for surgery. So, in order for microorganisms not to, to be free from that area, we have to practice the surgical aseptic technique. First, we have to go to your uh, standard precautions or your aseptic technique or your medical aseptic technique. So standard precautions is used in all patients in general, like I mentioned earlier, with or without suspected infection. No, it is used to protect yourself and the patient as well. So these are your hand hygiene. We do this before and after patient contact to avoid the spread of infection. We also have your PPE that can be used to protect your clothing from mucus, blood, and other body fluids. So this is your gown, gloves, mask, goggles, and face shield. No? We also have patient equipment that needs to be kept clean to avoid contamination. So this is part of your standard precaution. No? Disinfection should be done regularly. Kasi dito, yung mga patient equipment is, let's say for example, your IV stand. Hindi naman maiiwasan na hawakan niya ng patient. And also, of course, you. So, it is very important that it needs to be clean. No? Although these standard precautions also include your injection safety practices, your proper needle cupping and disposing. No? We have a specific uh, container for that. No? The sharps container. No? Environmental cleaning also, ito yung mga paligid ng patients nyo or the patient's room. Make sure that yung everything is maintained in a clean environment for you and your patient. No? Proper disinfection din is needed. So, yun. Kasi sabi ko kanina, di ba, yung mga inanimate objects that surrounds the patient, this can be one of your mode of transmission. Okay, so what else? Yan, yung respiratory hygiene for your patients who have respiratory infections. We have to teach proper coughing, sneezing, no? And sneezing, yung proper disposable tissue after using it during a cough or a sneeze. Okay. So ano naman itong isolation-based precaution nyo? No? These are your, these are your, yeah, airborne droplet contact, no? Precautions. Basically, it is your standard precaution, but or if and when you suspect a patient has an infection, you can classify it as a and if you can classify it as a communicable disease, we have to add on these three special precautions to avoid transmission of the disease. No, isolation-based precaution ensures the safety of the healthcare personnel as well as the other patients that he is handling or giving care. Siyempre, as a nurse, hindi lang isa yung pasyente yung hahawakan mo. There are also others. So, in order to break the chain of infection, we practice this isolation-based precautions for those communicable disease that are classified into these airborne droplet or contact transmission. So these are your contact-based, I mean your transmission-based precautions. Okay. Airborne transmission. What is this? These are transmitted pathogens that are droplet nuclei, which are very small particles. Na-mention ko na to earlier kanina, di ba? And then yun, this particle floats in the air and stays there for a long period of time. Kaya for those patients with airborne precaution who are classified into airborne precaution, they should be put in a room that has negative air pressure, meaning the air from the room is being sucked out towards the outside through a vent. No? Kasi if it will go outside, it will already be dispersed and lesser chances of being transmitted to person. So the airflow should be going towards outside the room. Para hindi umikot-ikot lang yung pathogens which are floating dun sa room ng patient. Okay? So, yun. To prevent airborne transmission, we are adding a special mask or a respirator. Usually it is the N95 mask or respirator. This can filter very small particles which is ideal for this type of transmission. No? So proper ventilation, kanina sinabi ko sa inyo, should be the air pressure in the room should be negative air pressure. Okay, so how about droplet? I mentioned also kanina na droplet is around, it can be transmitted around 3 feet, no? By direct or direct contact to the susceptible host body or body fluids, no? The nose, mouth, as it has its point of entry. Okay, pwede rin indirect to if a droplet lands on the surface near the patient, can be touched and transmitted. So this is your indirect contact. Okay, so yun. So these infected droplets usually last for a few minutes. Okay, if we are practicing environmental cleaning yung sa room ng patient, we can also break the chain by doing that. Okay. So how about contact precaution? These are your direct and indirect contact. So direct transmission, no, is done through person to person, while yung indirect is through inanimate objects, yung mga bagay, yung mga belongings ng mga patient. These are this can lead to indirect transfer, no? So for these contact precautions, we are using our gloves and gown, no, as 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 a barrier or to prevent infection. So now let's go to your mga medical aseptic techniques, no? Hand hygiene is your always a hand uh, is always a standard precautions. We do it before and after the patient before and after entering or being with the patient. No, how do you do it? So these are the steps. After applying soap, will rub your hand palm to palm, no? Then palm to fingers, palm with fingers interlaced, and then rubbing your palms and fingertips and under nails. Next, we rub it in between fingers. Rub each thumb clasped in opposite hand using rotational movement. Rub each wrist, no, with opposite hand, and then rinse, diba? So that is your hand hygiene. So what are your barrier techniques? No, these are your PPEs, your gowns, your gloves, your mask, your goggles. This is your barrier techniques. No, before we these are some key points to always remember. When putting on PPE before entering the patient, we put PPE rather before entering the patient's room. No, we keep hands away from the face and don't touch the PPE because that is considered as soil when you enter the patient's room. No, avoid touching areas in the patient's room. Remove PPE at the patient's doorway or outside of the room. And hand washing, di ba? Hand washing before and after patient interaction. Then remove your respirator outside the room after closing the patient's door. Why? Because di ba sabi ko kanina, we are using the N95 respirator for airborne precaution, as an airborne precaution. So the room must be closed para hindi lalabas yung mga airborne pathogens. So when the room is closed, it is safe for you to remove the respirator. Yeah. So if hands become contaminated during PPE removal, you have to stop and perform hand hygiene. Then proceed again with your PPE removal. Okay? So ito. So how do you don and doff your PPE? So for donning, this is the sequence, no? Hand hygiene, gown, and then you wear your mask or respirator, goggles or face shield, and then your gloves. There is also a different sequence dun sa doffing nyo. Mauna ang gloves, followed by your goggles and face shield, then your gown, and then your mask or respirator. And then perform hand hygiene. Bakit sa tingin nyo kailangan na mauna ang gown? I mean, dito sa doffing, bakit sa tingin nyo kailangan mauna ang gloves? Gloves, when this is considered soiled, no? This is because you'll be touching the patient. And then, after you remove the gloves, you have clean hands. So, you can remove already your goggles and face shield, no? From top to bottom. Pero bakit dito? The gown is the first to be removed than rather than the mask or respirator. Kasi while removing the gown, there will be some rubbing motion which can agitate yung mga kumapit na microorganisms doon sa gown. So in order for you not to inhale that, you have to remove the gown first, no? Before the mask or respirator. And then hand hygiene before and after the procedure. Okay. I want you to watch this
First,
video.
perform hand hygiene.
No, this is a video of your donning and doffing your PPE.
Okay, first we're going to put on the gown and we're going to put it over our head and we're going to slide our arms through the sleeve. strap.
Sorry, ulitin ko lang. Hindi pala naka-share yung sound. Yeah, let's watch that video again.
First, perform hand hygiene. Okay, first we're going to put on the gown and we're going to put it over our head and we're going to slide our arms through the sleeves. And this particular gown has hooks where you stick your thumb. So be sure to use those because that will keep your gown secure while you're providing patient care. Then we're going to make sure we tie all the ties in the back. Next, we're going to place on our face mask and you'll want to put it over the bridge of your nose and make sure that you form it around your nose to fit and put the straps around your ears and pull the bottom of the mask down to cup around your chin. So everything is covered, your mouth and your nose. You will take the mask, place it over your nose and mouth, cupping it in your hand. Then you will take the nose piece and form it around your nose. Take the top strap and pull it to the top of your head. Then take the bottom strap and pull it to the base of the neck. Next, perform the seal check. Place your hands over the mask and gently inhale and exhale, feeling for any air leakage. Next, you will place the goggles or face shield onto your eyes, making sure they fit snugly but not too tight. And finally, don your gloves, making sure that you pull the cuff of the glove up over your gown for extra protection. And this is how everything will look.
Okay, so that's your donning of your PPE, no? Okay. So before we proceed to the removal or the doffing of your PPE, first we have to consider yung mga contaminated areas. So the outside of your gloves, the front of your gown, this is the ones facing your patient. So these are contaminated areas. The gown sleeve, and then the front of your face shield, no? Everything in front is considered contaminated, no? Even the front of your mask. And then the clean areas naman is the inside of your gloves, no? Because the outside is the only part that is coming in direct contact with the patient. The back of the gown, because it's facing away from the patient, is considered clean. Then the gown ties, the strap of the face shield are clean, strap of the mask are clean. Okay. Now let's proceed to the video of the removing or doffing of your PPE.
First, you will remove the gloves. And by doing that, you will take one hand and you will pinch the cuff of the other glove. Then you will just peel it away and grab that glove in that gloved hand and then take your finger underneath the glove, because remember the inside of the gloves are clean, and just peel it off and then discard. Next, you will remove your goggles, and remember you will remove them from the straps because that is a clean area. So you will take them, remove them off, and then discard. Now we're going to remove the gown, and remember the back of the gown and the ties are clean. So we're going to untie the gown. Now what we're going to do is we're going to remove the gown, and we're going to do this from the inside out. So we're going to slide our arms up through the sleeves and pull the gown from the neck and the shoulders, and this specific gown will pop off. And we want to be careful not to touch the outside of the gown because it is contaminated, and we'll roll the gown into a bundle and then discard. Then we're going to remove our mask, and remember the straps of the mask are clean, the outside of the mask, the front is contaminated, so we cannot touch that. So we'll take both of our fingers and remove the straps of the mask and then discard. Now we're going to remove our respirator. And remember, you will do this outside the patient's room with the door closed. And what we want to do is we don't want to touch the outside of the mask. So we're going to slightly just lean forward and we're going to remove the bottom strap first with both of our fingers. So grab the strap, pull it over your hood. Do not touch the front of the mask. Then we're going to remove the top strap in the same fashion. And then we will discard. Then you will perform hand hygiene.
Okay, so that's your donning and doffing of your PPE. Okay, so that basically covers your medical asepsis. No? Um, the next lecture would be your surgical asepsis. So it will be discussed on a separate video. So I hope you can review these concepts that I've discussed with you on this video, and I'll be sending pointers and notes over to you, and some activities as well about this topic. No? Okay. So that ends my lecture for this video. Thank you.